All right, we're recording. So welcome. I'm Susan Blum. Today is Friday, April 24th. Really important to mark the moment in time. It's 2019. Oh, it's 2020. I'm really in a time warp, aren't I? I wish it was 2019 because it's 2020 and we are in the middle of a coronavirus pandemic called COVID-19. That's the name of the disease that this coronavirus causes. That's the name of the illness. And we are all I'm using the word quarantine, but technically it's just sheltering at home. Where most of us in the country are under the shelter at home orders from our different various states. The states have made their own individual orders to manage how we're all to manage this, because every state in this country is different and have different kinds of populations, different kind of urban centers. And so our governors are really guiding us on when we stay at home and when we can loosen those restrictions. In this coming week, as most of you know, there are some states in our country that are going to start loosening their restrictions, and they'll be sort of the experiment, right? There's going to be a big experiment coming this week. So when we look back on this video a year from now or however long from now, in this moment, what's happening is most of the country has been in a shelter at home order. And this next week is going to see the first relaxing of this in several states where their governors feel, or their numbers have been going down, or they've plateaued, or they're at a point where their governors feel they can start loosening restrictions. And so we're going to see what happens. I'm in New York, and as far as I know, May 15th is sort of when Governor Cuomo said we're going to start loosening our at-home restrictions. So I'm going to be here for another couple of weeks, and we will continue our I'm going to keep coming to you every Friday, and I don't know. I think I'm just going to keep doing it for as long as we want to. But this has become part of my Friday schedule. My welcoming the weekend is sharing this time with all of you. And so as we get to our Q&A, a lot of the questions, so I welcome questions about my thoughts about the pandemic and what's coming next, and the September surge, is that going to happen? So public health questions. I do have my master's in public health, and I'm staying up on all that, and I have my own thoughts from everything I've read, so I can answer questions about that if you're interested, right? So I want to stick with what you guys really want to know. The other big topics, which I am going to touch on, what I'm aware of, I've learned this week. So news from this week, right? Because we're doing this every week on the treatment front and on the testing front, right? So there's some big news this week. So I want to talk about that, and then we'll go into questions. And then your questions, I invite you to ask me questions about immunity and immune system and how to optimize your immune system. I am a functional medicine specialist after all, and I did write a book called The Immune System Recovery Plan. And so, I am pretty well versed on how to have optimal functioning of the immune system. And it turns out that really, this whole idea of how we going to live and do a dance with this virus, this idea of right now we're doing a hammer, and then we move into the dance phase, and we're going to be dancing with this for a little while. And how do we help improve how we do the dance? And the virus is the virus, and whether you get sick or how sick you get depends on what we call the host, which is you and me. And so how do we help our immune system be optimized so that the host response is as good as possible? Helps helps us have the most mild or asymptomatic case as we can. And there are people I'm hearing all over the place, people who are turning out to have had very mild illness, and then we hear people who didn't get it from their spouse, and so there's all sorts of interesting stories everywhere around me, because I'm continuing to see patients virtually, and as well as answer emails to my existing patients. And, so I'm very, I've got my ear to the ground, right? And I'm hearing what's going on out there. All right, so let's just jump into what I call my opening monologue. The two things I'm just going to talk about before we jump into questions is is this whole what's going on with treatment. What did we learn this week? And so the National Institute of Health released a review of all the studies that are ongoing so far. And actually, it wasn't great news, right? It does not, and there have been several studies. Now, when I say this out loud to a big forum like this, I get all these emails, or I think last week somebody pinged me and said, But wait a minute, there were good studies, there are definitely reports about Plaquenil being good. So there were initial studies about Plaquenil being good, or initial reports. They were really case reports. They were reports out of Italy that tried it and thought it was working good. And so far, believe me, there's nobody more than me who wants to believe Plaquenil is going to be like work, right? But so a lot of people have a lot of scientists jumped in and clinicians to try to study this and to see, is it true? Does Plaquenil work? Let's see if we can validate it. And there just has not been any more validating studies, and the studies are not showing that it's particularly helpful. And so the Plaquenil is sort of going like this. They're still doing it, and their studies are still going on. Another month, I'd say by the end of May, we're going to know a lot more. But so far, Plaquenil has not lived up to its hype. And so if you get sick, I would not tell you to take it. Okay? And I'm not prescribing it for my patients. Okay, so that's based upon what I've read. And there's nobody more than me who wants to believe that it's good. All right, so that's the Plaquenil. The remdesivir, which is the antiviral study, it's the one that was used in Ebola. The preliminary reports on that came out this week. That wasn't great either. There's still some case studies which suggest it is, but the first sort of randomized, the control studies that are coming out aren't that promising. And so I don't know about remdesivir anymore. And so, but the jury's still out. I'm just giving you the updates. The couple of studies that have been sort of being released this week that I've read, there's nothing. I mean, it would be great. It just, if you look at if you look at just sort of neutral, they're sort of on the negative side of neutral. It doesn't mean we're giving up, and maybe there's just more and bigger studies to really see the effect in more people as they start collecting more and more data. But it would have been nice if it was drifted to the right, if it was drifted towards positive, but it hasn't been. I think we still have hopes about the convalescent serum, which is antibodies that you make, someone who had it, who makes good antibodies, giving it to people who are sick. And so we're still doing that. And so if you had COVID, go to the blood bank and get tested to see if you're making good antibodies, and then they'll take your blood. They'll screen you and then take your blood, and we still want to do that. So I think that's, it's a little bit of what we call a Hail Mary, it's a little bit of a, that's not a targeted treatment against this virus and this disease, but it's some way to help people who are really sick. There's more and more research, and so there's a lot of really good people out there now doing research on and trying to understand, mining the data. They have medical students like mining the data to try to figure out exactly what are the characteristics of the people who get the sickest. What do they present with? Are those the people with the cough, who have a cough? Are those the people with the fever? So as a way to sort of predict the course when somebody comes into the emergency room, how do you know right away if those are the people that are going to end up in the worst case? So there's so much research, and I said this last week too, that we're still learning, and unfortunately we're not there yet in everything we need to know. And that's why we're still home, and we'll be home for a few more weeks, certainly in New York. I'm thinking of baby steps, opening my office to seeing patients again, very spread out, and rotating our clinicians in June. So that's sort of what I'm planning on here in New York. And so that's my little thing about treatment. More discussion about vitamin C and how great that is in treatment, and hospitals that used it intravenous. And so don't forget your vitamin C. I've told you all about that from the very beginning. And we'll see what new treatments sort of come on board. There's a lot of pushback on using this whole idea that to treat people that have the respiratory distress, like they have high altitude sickness and pulmonary edema, this thing called HAPE. I talked about that last week. A lot of pushback against that and the differences between COVID people and HAPE people, and not to treat people the way that we treat high altitude sickness people, that it could actually really hurt the people. So there's a raging debate going on about that, more next week. But there's no automatic adoption of changing, how we treat people, but there is a change in sort of the respirator settings in the emergency room. From a public health perspective, our numbers were really on the other side of the mountain in most places in the country. There's some places still on the way up, but we know sheltering in place really did work. Now, I want to just talk about antibody testing because that's really the hot thing right now. And, that's really the hot thing right now. And so, wait, I gotta pause 1 second. Sorry. So antibody testing is really hot right now. And what I would say is, um, that the good news is the testing capability is on the way up. So we're definitely gonna be able to test antibodies. And actually, I have big news that the finger stick kit is now available and I can send it to people's houses and you can do it yourself. The other big news is that Quest and LabCorp are now doing antibody testing, and you can go to Quest and LabCorp. That's just the name of our routine labs that we have here at Blum Center. What I want to remind everyone, there's all this controversy about antibody testing and what it tells you and what it doesn't, okay? The concern is that if you test positive to antibodies, that there's some cross reaction between other coronaviruses that you could be false positive, it's called. And then it can give you a false sense of security. So the main thing is to sort of interpret your test results with a grain of salt. Like, you have to interpret your test results with understanding what your situation is, right? So for example, I've been doing antibody testing a whole bunch. I have a whole bunch of people now that I've tested, which is great. And what I found is that people who are positive have had COVID. I have somebody who was positive who was sick and didn't really match COVID, but it could have been. And it turns out that she's positive, but it makes sense that she's positive because she definitely had an illness. I've been testing people who their spouse had COVID and they wanted to, but they never really got sick. And so they wanted to see whether or not, they might have gotten it and didn't know it, and asymptomatic. My asymptomatic people, one of them was negative. And so I think when, in that case, if somebody, was positive and the person who had COVID was antibody positive, but my patient who was negative, it was her spouse who was positive and she was negative. And I think that pretty much she has to assume she's negative and she's still susceptible. So you see what I mean? There's a way to use it to help you figure it out. One of my patients who was positive and had that illness, she wasn't sure. Her partner also was positive, even though he was asymptomatic, but it made sense because he had exposure. And so I think that we're going to find out that most people, that this is a way for us to sort of sort out, did you get it from someone that you were definitely exposed to? Was that illness that you had in January or February, was that it? Do you have antibodies? And that being positive sort of makes sense for you in some way. And so that's the first part. It's like how to know for sure if your test is positive, if that's really COVID or is it a cross reaction from another coronavirus. The cross reaction rate is very low. And that's something called specificity of the test. And so these tests that have Quest and LabCorp were FDA emergency approved. They're testing the S-spike protein, I think it's called. KBMO, the one that I'm using for the fingerstick, tests the nucleic acid. And I've been using both Quest and LabCorp. I've been using multiple tests that do it all different ways to make sure they're all the same. And so far, my KBMO tests are the results are the same as Quest, which I've now been sending to this week. Which is also the same as I got this quick test that's 15 minutes from China. I got this quick test that they used in the hospitals. And I was doing that in the office, and I now have correlated all three in several people, and they're all coming up the same. So my own internal thing is that I actually am thinking the tests are consistently replicable. And so I think that's good. So I actually think that these tests are really good for you if you were sick and you're not sure what it was, if you were definitely exposed to somebody or lived in the house with somebody who was sick, you never got sick, and you just want to know if you got it from them, even though you might have been asymptomatic, or if you just want to be screened because you've been out and about or you were just in the city on the subways, and even though you never got sick. And so you can definitely go get screened now. Okay. And so that's the answer about that. Now, I think it's good. The other big thing we don't know yet about antibody testing, which so the other thing about the antibody testing is that we're still doing studies to figure out how long it's going to take to, in terms of antibody testing, how long, first of all, do those antibodies confer immunity for you? Like, does that make you immune? Can you not get it again? We think so. In SARS and MERS, which are similar coronavirus epidemics, people were immune for up to 2 to 3 years, depending on which one. So we hope so, and we believe so, but we haven't proven it yet in the lab. So just because you're antibody positive doesn't guarantee you're not going to get it again until we can get some studies on that. We believe it will, but it does mean that you had it. It does mean you're making antibodies. And the fact that they're using your antibodies to help treat other people successfully tells me that chances are it means that you're going to have some immunity. There's different kinds of antibodies. There's ones that are called neutralizing antibodies, and there's some that don't neutralize as well. So we're learning a lot more about what being antibody positive really means. But at least it means you have the best chance of anybody. I mean, it means you had it. And we're still going to figure out exactly how much immunity you're going to get from your antibodies. So still be careful, still wear your mask, still social distance. So that's the other big news about the antibody testing. It's really good news. It means you have the antibodies. Stay tuned till we learn a little bit more about how much immunity it gives you. But my guess is we're going to learn it definitely is going to give you some kind of immunity, even if it's not, as long as we'd hope, or as good as we could. So that's that. And so we're good with that. Okay. And so I'm going to start answering questions. So that's really my whole thing that I wanted to share, actually, about the antibodies. It's confusing. And so let me see what questions you have. Okay. And as a reminder from me, and I'm going to share my screen for just a second. I did tell everyone that we can do the antibody testing now. This is at Blum Center. I can order LabCorp and Quest. If you're one of our patients and you want us to order it for you, you have to go to LabCorp and Quest. I got this great, and actually I want you to know that I think it's safe. I feel it's safe for you to go back out and get your blood work done. I've had a lot of people getting blood work done. LabCorp just sent us an email, our rep, telling us that they have a system so that they'll text you. You can wait in your car, and they will text you to come in as soon as it's your turn. If there are multiple people in the waiting room. I've had people go to Quest and there was nobody there. So you definitely can go. We can order it for you to LabCorp and Quest. They're only doing IgG. Now, IgG is the antibody that rises after it's at least 3 to 4 weeks. And so if you want to go get a LabCorp testing done or Quest, you want to wait until it's been at least a month, you think, since you were exposed, or since you had some sort of a cold or an infection, or some sort of symptoms. And so if you're going to go, make sure that you're at least a month out to optimize the fact that you'll pick that up. Because IgG, it takes at least usually 3 to 4 weeks for the IgG antibodies to rise. IgM antibodies will rise by the end of the first week. That's the immediate one. LabCorp and Quest are not testing that's IgM. They're not testing IgM. The finger stick that now I just got the announcement from KBMO. I've been using their blood test from the office to validate that their testing is a valid test. And they now offer a finger stick kit you can do from home. That's IgM and IgG. So that will pick up sort of where you are in the process. So if you have a more recent infection, I would wait till it's at least 2 weeks out before you would do the KBMO test, in order to make sure we pick up the IgM antibodies. And so we can interpret that. If your IgM is positive, but your IgG is negative, you're sort of early on. If if the IgG is positive, but not IgM, it means you're a little further out. And so, so that's really the story with that. And so here's how to do that. So if you want to do the finger stick, if you're an active patient at Blum Center, you can just email June. If you're not, then you can email admin, and they will take you through how to become a patient at the office in order to do that. Okay, so I'll post that again later. All right, so I'm going to go back to questions now because I'm sure there are a lot, and then we'll go from there. All right, so I'm going to start at the top. All right, thoughts on glutathione for prevention. So glutathione is a fantastic antioxidant and it helps reduce free radicals. It's really good for your immune system in general. So for prevention, great. I haven't, the connection is not so much direct studies on the immune system as it is on its role in reducing oxidative stress, which is important for the immune system. Okay, so if you like glutathione, then 100%. Now, here's the thing. Pause on the supplements. When I give out my list of supplements or I tell people how great the supplements are, the list of things that are good, the goal isn't for you to take all of them. People come back and they're like, all right, I ordered them all. Okay, I'm not telling you to take 10 things. And so, but if you're a person that's really comfortable taking multiple things and you want to add more and more to the program, I'm not going to tell you you shouldn't. You're welcome to do that. But does everyone need to take all of these things? No. Okay, I'm not telling you you have to take them all. And so if you'd like to add glutathione, or now the thing I often give people for glutathione support is N-acetylcysteine. And we have talked about that at the beginning, right? NAC is a good protector for the lungs. It's a good antioxidant booster because it boosts glutathione. Is it on the top 3? No. I really want you to be taking zinc, vitamin C, and a probiotic, right? If my top 3. And then as you keep going down, sure, the more antioxidants, the better, whether you're doing it from food, whether you're doing it from more antioxidant supplements like a glutathione or a NAC, or even, vitamin A and vitamin E and resveratrol or other kinds of, superfoods, powders, there's all ways to get super greens, more antioxidants. Okay. Is collagen safe to take and what is the best one for osteoarthritis? Um, I don't really have a comment on the best one to take. You want to know the collagen source, and it's fine. It's perfectly safe to take. Collagen is a nice protein. It's a nice amino acid profile to support the collagen production in your body for people with arthritis. And so absolutely collagen, you can do collagen protein powder, which I think is sort of nice. And you can rotate through different kinds of protein powders, and that's one option. And I think it's really important to know the source. And so you want to make sure, I usually tell people New Zealand cows, because that they're really well treated and safe cows, meaning pesticides, herbicides, like all of New Zealand's organic. So anything bovine you sort of want to get from a New Zealand cow, or a grass-fed organic cow. So that's the main thing about that. Okay. New York Times recently discredited some of the COVID antibody tests on the market. I'm taking the COVID-19 antibody KBMO test soon. How does it compare to the others on the market? Yeah. And so I was talking about KBMO before. So KBMO is IgG and IgM. KBMO has the same risks of the rest of them in terms of the specificity. Every single antibody test right now, and in order to be approved or a valid test, you have to have at least 90% specificity. So there's going to be which means there's a very small percentage of people who it might pick up the other coronaviruses. But and so there's a list of coronaviruses it might pick up. It's not going to pick up influenza or the flu, but it can cross over to other coronaviruses, which is why, and that's the same as every other test that's right now on the market. Okay, so even the ones that are FDA approved and emergency approved. So KBMO has the same sort of specificity in terms of the cross reaction. Every test I've seen has that slight risk, which is why you want to know that, you were exposed to COVID, to really interpret this the best you can. If you had absolutely no exposure and you've been home for 6 weeks and you've been quarantining and there's no reason that you really had the possibility of being exposed and you were positive, you're the kind of person I'd say, I wonder if this is a cross reaction. And I would so I'm taking anyone that sort of fulfills that sort of bill, I would retest again, and perhaps in the future as the tests become more specific, where you won't have that cross reaction. That's the problem with all of them. The thing I like about KBMO as opposed to the other ones on the market is the KBMO tests for the nucleic acid, which does not vary. There are mutations happening amongst the different, as the virus has been making its way through the community. And KBMO looks at the nucleic acid, which doesn't mutate. So I think it's a really good test, which is why I opted for that one. I have other companies sending me, their pitching for me to offer their test to my patients, and that's the one I chose for that reason. Quest and LabCorp is the M spike. It's the spike protein. Maybe it's the S or the M. I don't know. It's a different, they're testing for the different protein, which is sort of interesting in terms of the possibility of it mutating. So they're slightly different, those two. But I think the main problem is, is the main problem with many of the tests is the same. That's the problem with all the tests, which is, does it really confer immunity? Are these the right blocking? They're called the neutralizing antibodies. Are we testing the right antibodies to make sure that that's giving you immunity? And they're all testing the same in that way. And then the specificity, are they all crossing over to other coronaviruses? And so we haven't fixed that yet. So again, in somebody who has a reason that they might have been exposed, I think that if you're positive, then I think you can use that information and believe that you likely did get exposure or had it. But again, for now, until we sort of get a lot of clarity on all of that, you still want to social distance. You still want to be careful because we don't know, even if it's positive, we don't know if you can't catch it again for sure. And we have more information coming out on that. So all of you who turn out positive on these antibody tests, it helps us know if you did get it, most likely from your spouse, or that sickness you had was it. And then we have to still see whether or not that really confers immunity. So you're still going to wear a mask and be careful and social distance. Please discuss if sunlight is helpful for the virus. Sunlight is helpful from the virus. It will die if it's out in the sun, which is why like your mask or whatever, your clothes that you wear, you can put those out if it's sunny or you live in a hot climate. You can put them outside on your terrace or outside and let it disinfect that way on a neutral top surface. So the virus will die in the heat and in the sunlight. But that only is going to help about outdoor surfaces. It's not going to really affect, which is why we think that in the summer we might get a drop off in the viral load and the community spread, because people will be outside. The sunlight will help decrease transmission because it really should not live on the surfaces that are exposed to the sun. The droplets, when somebody coughs is sick and the droplets all land, there's a short amount of time that it'll live and then it'll die because it'll be exposed to the sun. So you just won't have like propagation of the virus outside as easily. It's not going to do anything for, there was some discussion of using UV to help treat you. It's not going to treat you. It's just going to reduce transmission in hot climates and hot sunny climates when people are outside, okay? Especially if they social distance. Right? If you stay a little far away from each other, the surfaces will be less contagious. How does a cytokine storm relate to COVID-19? So a cytokine storm is and think of it like an overreaction of the immune system. It's like a runaway train. So the immune system gets ramped up to fight the virus, and it just goes and doesn't stop. And it becomes a runaway train. And so it's an overproduction. You end up releasing so many cytokines, which are inflammatory chemicals that actually, one of the ways that they work is by irritating the inside of your body. They irritate the tissues as part of their immune response, right? As part of, they're going after to kill things. And so this is the chemicals in your body that are released in order to sort of kill the virus, and it creates an enormous amount of inflammation, an enormous amount of tissue damage as bystanding byproducts. I've talked about that a lot in my webinars and things that I do, just talking about inflammation and autoimmunity and arthritis, right? And that a lot of the pain and swelling and heat that you feel in your joints is because of the release of the inflammatory chemicals. They're irritating. They cause redness, swelling, pain, and heat. That's the inflammation. And so it's almost the innocent bystander tissue damage that happens when inflammation runs its course and when the immune system doing its job runs its course. A lot of the symptoms you feel when you have a cold and all the congestion or an upper respiratory infection or pneumonia, a lot of your symptoms are because of you can't because of the bystanding. It's like your tissues are this innocent bystander from the crazy immune reaction. And so a cytokine storm is when you have you have a normal amount of that as part of an inflammatory immune response. But the reason why it's called a storm is because it goes even beyond that. And instead of a regular sort of where it's raining outside, it becomes a tornado. And all those cytokines, all those chemicals the levels just go really high and invade the tissues of different organs. And that's now why we're seeing clotting issues. We're seeing liver dysfunction. We're seeing brain. It's in the brain, right? And so we're seeing it everywhere. And so that's the cytokine storm. Okay. Okay, so let's see what's next for our okay, just answering that. Okay, cool. So let's go back to the next question. What's your opinion about Chinese FDA versus US food testing options and validity? I don't think we're going to need the Chinese options anymore because we're going to have it in the US. I said before, I did get one of those kits, that's 15 minutes in the office. It looks like a little pregnancy test with a finger stick. And I did get that and I was using it and it's turning out and that came from China. And so I have 3 different tests I'm doing now and I experimented on people who are willing to do all of them. And so I'm finding China's just fine so far. But I can only say that that's the one that I'm doing. And so I don't know about the other ones. So sorry, I can't say more about that. There's probably many from China. Okay. Story report on NBC show today, 3rd hour, Friday, April 24th. Well, it's right off of I didn't see it. So, was having cytokine storm so Dr. Fisk was having cytokine storm. He was put on IL-6, right, Actemra. That's the name of that, which shuts off the immune system. They think best window for use is post-virus, but before being put on a ventilator. Seems to work for younger, healthier patients. He recovered because of this approach. With this in mind, do you think an older obese person with autoimmune disease should continue or restart, as I have stopped taking Enbrel? Okay. So the question is, somebody has high risk on an autoimmune person, should you go taking Enbrel as a way to keep cytokine storm? Okay, got it. So the question is, so 3rd kind of treatment that's still being studied and we don't know yet, okay? But it's really another one I didn't talk about yet, which is drugs that are used to shut off the immune system, to shut off cytokine storm. And so the cytokine storm is a very specific activation of a certain pathway. It's called IL-6. And it looks like Actemra is the one that shuts off that particular pathway of IL-6. So it's not just everything goes crazy. It's not every cytokine. It's just that one pathway. And that's why they're using Actemra. And I'm really excited about the possibility of Actemra for the sickest people. And it looks like it's very promising. The studies are not definitive yet. So I'm really happy to hear that story because that's another whole line. And so if we all knew that, that there's a really good treatment for people that can keep them off of a respirator and we could pick up really quickly who's at risk for going into cytokine storm and we could put them on that medicine sooner. That's like one of those things I was talking about the data we're trying to get, like who's likely to end up cytokine storm. Then we can give Actemra to them because not everybody needs that. So that's the first part of the answer to the question is in terms of Actemra itself, in terms of this question about this other drug called Actemra. And so yes, very promising as a treatment to prevent people from going in on a respirator, or as soon as they end up on a respirator, start it right away. But you want to do it early before they end up going over the cliff, which is what we're working on, catching them sooner. For you, or for those of you listening who are on other medication for your autoimmunity, Other than Actemra, those drugs or those medications are not going to stop the cytokine storm because they're not specific for IL-6. So unless they're specifically an IL-6 inhibitor, then it's not relevant, okay? Then we come to the decision of whether you stay on your medicine or not. And so what this person asked and said, I was on Enbrel and I decided to stop it because I was afraid of the immune suppression. And that's a fair concern because at the earlier stages where you're going to be fighting it, you need to fight the virus when you first get it. Disarming, it's like putting a hand behind your back for your immune system. And so I am not giving you medical advice and I am not telling you to go off your medicine. You need to make that decision with your rheumatologist. So I think on a case-by-case basis, each of you should contact your rheumatologist if you haven't already and just say, can we look at all the medication I'm on? And is there a way for me to cut back on any of these, at least for now, to help my immune system so that I can, not have immunosuppression? Because these are suppressing your immune system. So it would be good to help your immune system function better by getting off of anything that you can get off of. Do never stop medicine yourself, and I am not telling you to stop it. For a lot of you, it might not be feasible to go off your medicine, especially if you're on prednisone. I mean, you could have a really serious flare. You could get very sick. And so don't ever do this without checking with your doctor. But if you've been stable for a while, and you've been on this, you're sort of on it for maintenance at this point, then it might be just fine for you to make a change. And so contact your doctor. Okay. So I hope I answered all the questions pertaining to that. Okay, let's see. Next question. Does celiac disease as an autoimmune disease make a person more susceptible or make the symptoms more severe? Not that I'm aware of. So an autoimmune condition all by itself shouldn't put you at an increased risk of getting more severe COVID. It really looks like it's the whole spectrum of people that might have alterations in their ACE system. And so that's the obesity, diabetes, hypertension, metabolic syndrome people, because we believe, and this is where more research is happening, that people that have those conditions might have something abnormal going on in their ACE, which is the angiotensin converting enzyme system. And so you have a foundational problem there that the virus is capitalizing on. They're taking advantage of an imbalance or problem you have in that ACE system. And it's actually looking like people on ACE inhibitors or that are on medications that affect this system for hypertension are protected from the virus by being on that medication. It doesn't mean they're not putting people on it prophylactically, but if you're already on those kinds of medication for your high blood pressure, it's turning out to be a good thing. So it doesn't, at first everyone thought, do we need to stop those medicines? And it turns out, no. This week I read some discussions about some reports that it's looking like they're protective. Jury's still out. Don't take that, home as a final word, but so if you have a Hashimoto's, celiac, and you're not on any immune suppressing medicine, you should be okay. Now, that being said, and I answered this last week too, as long as you're following your gluten-free diet and it's under control and your immune system's good, for people with other autoimmunity like Hashimoto's, you want to make sure your gut health is good. So even with celiac, anyone with autoimmunity, the gut microbiome is going to be critical for you. Remember I talked at the beginning of this hour about how sick you get depends upon getting the virus, but it's your host, it's you, right? It's all of this here. It's you, who you are, and your body and your immune system. And so those of you with autoimmunity, there's no correlation in what we're seeing, and there's no studies showing that you're at an increased risk in that category as a category. But I will tell you that the goal, especially because I think the virus is going to be in the community for the next year or longer, and we're going to be doing this dance with the virus, you want to increase the health of you as a host. And so if you have autoimmunity, you want to optimize your immune system and make sure it's good. This is what we're here for you at Blum Center. I mean, we're all autoimmune experts, a functional medicine person, integrated medicine. That's what we do. That's what I do. You can read my book, Immune System Recovery Plan. It's how to have a healthy immune system. And it talks to people with autoimmunity, like how to help you do that. So even though you're not a direct high risk, We want to help you have a low risk of getting sick if you got infected, help you weather the virus, and optimizing the host and the immune system is the path to that. So go on my website, join one of our online groups, group coaching, read the book, come see us. We now can see people virtually. There are 3 of us practitioners who see patients, and we can help you improve the functioning of your immune system. We can now do it virtually no matter where you live now that the telemedicine rules are lax. So come find us. We're here for you. That's why I'm doing this every week. Reliability of antibody testing, false positive and negatives. Yeah, Marla, I talked about that. You definitely have every test that you do, even when you go get your cholesterol, when you get a test done at Quest and LabCorp, it's called sensitivity and specificity. A good test is above 90%, 90%. So in every single test that you've ever done for any infectious agent, every test, there's no such thing as 100%. And there's no test out. So all the tests that are working out there, that are being offered, have what's considered acceptable levels of sensitivity and specificity, which means false positives and false negatives. So there are always going to be false positives and negatives. That's why your story and how you interpret the results are important. We can help you interpret them if you need help with that. Can someone who has antibodies infect other people? Good question. I don't know the answer to that, because the antibody test doesn't tell you if you're over your infection, right? That's a COVID test. And so depending, if you don't have IgM antibodies anymore and you only have IgG, and once you have IgG, you can think that maybe you're a month out. It's likely you can't infect anyone. But we don't really know, because there's some reports that they're swabbing people in China that they're negative and then they come back positive, and we think maybe that's just the problems with the test, that sometimes it's false positive, false negative. And it might mean that we might have to come to a time when, if you're antibody positive and you weren't sick, like if you're antibody positive and you know that you were sick, the idea is that 21 days from the first day you got sick, we think you're not shedding the virus anymore, and we think you can't give it to someone. If you're, and the rule of thumb that the CDC and the guidelines are telling us, wait 1 second, excuse me. Oh my God, I have the heat on in here, I'm dying. The heat just turned on. So we think that the guidelines that the hospitals are telling us and that the public health people are telling us is that 3 weeks out from 21 days after you first got sick, and at least 7 days from your last symptom. So if you were sick, then those are the guidelines for you to go by to decide if you're still contagious. If you were never sick, but somebody in your house was sick, and you were never sick, so you can't use that as a guideline, you can go from when you think you were exposed. So 21 days from when you were exposed. Then you add that into the results of the test. And if you're doing IgM and IgG, you can that helps me a little bit with the timeline in terms of interpreting it. If you're only doing IgG and you're IgG positive, then you have to figure you're at least, like Quest and LabCorp are only testing IgG, so you can't get the early antibody. See what I'm saying? So there's like a whole story. It has to be personalized for somebody, which is why it's really helpful if you get the test. If you do the test through us, then we're going to coach you through the results. You'll get the results. We have to know your whole story, and then we can help you interpret whether we think you're still contagious. And then on the last piece is, if you turn out you're antibody positive and you're not sure about any of it, you can get a COVID test. And they're doing COVID testing now through LabCorp and Quest. And pretty soon, they're actually doing, there's ways to get the COVID test is going to be more accessible too. And then you might be able to get a COVID test. So complicated, right? Which is why I have to insist that anybody I do the antibody test for has to be a patient of ours. And so if you're not currently a patient, you have to become a patient, because we're going to have to explain the results to you. It's not as simple as black and white. Okay. I hope that helped. Can you please review how to best take your family in the event that both me and my husband get the virus? We have 3 small children. So obviously wouldn't be able to quarantine ourselves to a room, nor do we have family nearby. I'm not sure the question in terms of how to take care of yourself if you and your husband both get sick. Um, I don't know. Chances are you and your husband would be staggered in how you'd get sick, and you wouldn't be both, because one of you would get it first, and then it might be a week later when the other one gets it. And so hopefully one of you will be recovering when the other one might get sick. That's sort of your own strategy for your family you're going to have to come up with. I'm sorry, I can't be more helpful with that. In terms of your kids, to make sure that they don't get, like, as soon as one person gets sick, you want to like go not start giving really high dose vitamin C. Vitamin C is like the go-to. As soon as you get exposed or anybody gets sick, you want to go right away, and start upping everybody's vitamin C, and you can give vitamin C to kids. Okay. One sec. I just. Okay, good. And so let me come back to this. All right, good. And so so that's my answer for that. All right. So any update? All right. I'm so stressed that my period is all out of whack. I know. Not sleeping well, my blood pressure is going up. Not sure if this is because of everything that's going on or coincidence. Trying to keep my healthy routine but failing. Yeah. So it's a really good thing for us to talk about for a minute, is about stress. So everybody that's listening here, you all need to make a strategy for how you're going to manage and what you're doing to cope. And so everybody's going to have a different thing that's going to work for them. I've started changing. So I encourage journaling or meditation of some kind if you already have a practice like that. So what are people bumping into, right? So the most important thing is keeping a routine. So you've got to have a routine. You've got to go to sleep. And if you're not and you got to go to sleep at a reasonable time. Don't stay up past 10 o'clock. Those are really important hours, 10, 10:30. If you're having trouble falling asleep, figure out why and do something about that. That's going to be really important. You might need to take some melatonin. You might need to take some CBD. You might need to listen to a guided visualization or an imagery to help you fall asleep. So we need to help you fall asleep. So there's so many things that come to my mind about like how to help in this situation. So having a routine is going to be really important. Helping you understand your stress is going to be really important. If you have a therapist you ever worked with before, that's great. If you need help with the stress, I have a great health coach. Her name is Melissa. You can go on our website and sign up for just online, you can sign up for coaching. We have a website called blumhealthmd.com, and there's Coach Me. You can just get a private coaching session and have someone help you figure that out. You need to find a way to go out for a walk. So nature, connection, to connect with people, schedule, call your friends, schedule. This past weekend, I had a Zoom group call I have this group of girlfriends, 6 of us, had a Zoom call. And so, a video chat, connections. We're isolated at home. And so you have to really take care of your mental health. I'm very big about meditation. This week, I actually started, maybe even last week I decided to start doing what's called meta meditation, which is loving kindness. And it's repeating phrases that's helping me feel less depressed, or focusing on the good stuff. So it's like, may I be grateful, may I be willing, may I be loving, and may I be engaged, and like repeating these phrases to help myself. And so we have to find our own best way to help ourselves. And so it's all these things. Pick which way to start. Creating a routine every day and having structure in some ways is the highest altitude way to start. That's the umbrella, right? Have a schedule. I took a shower today, right? Get up and get dressed, even though you're home. I work all week. I don't know who's home, people, and I don't have little children. But like there's work to be done. There's housework and cooking and food and finding the food, and I have 4 of us in the house, and and then working. Monday morning I go to work, but I have a schedule, and I'm sticking to my bedtime. I am having trouble sleeping too. And last night I took melatonin. It made me a little bit out of it, a little bit hungover today, but I did need melatonin last night. And so I have a lot of empathy for that, and compassion for everyone here who's struggling with that. And so so that's the story with that. And so if you find, so you have to figure out your own first step. And structure might be it. Scheduling sleep is really important, and find some sort of way to practice every day, getting your head and mind off of things. And maybe it's watching less news. And if you're struggling to do this on yourself, then get some help. And it could be with, a therapist, or it could be with a coach. So that's what I would say on that. And the update on the clinical trials with quercetin, I haven't seen anything about quercetin. So Marla, but if you hear of anything, let me know. I'm happy to hear about that. But quercetin is one of the vitamins that's also being looked at, as well as zinc. But vitamin C continues to be good. My friend says that her doctor in New York City will not do antibody testing because it's not FDA approved. Are your tests FDA approved? Does it matter? And so the Quest and LabCorp have emergency FDA approval. And so they just got their FDA approval last week and this week. And so the KBMO, my understanding is that it was FDA, that it got emergency approval as well. I'm pretty sure that it was. At least I remember seeing that. But then somebody told me that they're not sure, so I got to go back and look at that. But I'm doing my validations, validation testing across the board, and I'm finding it to be a very valid test. Anyway, I don't want to go back through all the different reasons that there's a problem with it, that antibody testing needs to be interpreted the way that it needs to. But it's my understanding that KBMO did get FDA emergency approval, as well as Quest and LabCorp. Dr. Blum, I've taken a couple of your classes. I recognize your name. Hi, Marina. Question, in your clinical experience, have you seen a lot of eye damage or other side effects with those taking Plaquenil? No. And actually, I might have to try this, trying to avoid Enbrel. I'm currently off all meds because we're trying for baby number 2. I might have to go back on something. Plaquenil would be a good choice for you now because it might help with COVID. And Plaquenil is really like 5 years down the road in terms of the eye damage, the concerns about the eyes. It's really being stuck on Plaquenil long term. I've never seen it happen to anyone in the short run. I've never seen it happen to anyone, actually. It's just that it can. And it's my understanding that it can as a long-term sequela. So I think you'd be fine with that, Marina. Have you seen cat's claw help at all with those with RA? I've looked into your iBook and just now didn't see it in the index. I tried it for a month, but it almost seemed to make things worse. Yeah, no, I haven't used cat's claw for that. We use cat's claw a lot for treating Lyme disease, actually. But no, I haven't used cat's claw for RA. If my spouse has a positive antibody result and is an essential worker, and I have a suppressed immune system and test negative for an antibody, do we still need to be distancing in the home, or can we ease up with our distancing? That's a really good question. So if your spouse is antibody positive, we still don't know if they're COVID negative. And so your spouse, before you can loosen up on anything, there's 2 things we need to know. You still want to social distance a little bit, but we want to make sure that really means your spouse is protected. We don't know yet if the antibodies really protect you. And so we should know that, and you can't get reinfected, right? And so I think we're going to know that in the next month. There's a lot of studies coming out in China about that. So you can't loosen up yet until we have more information. So next week, maybe I'll have more information for you about that, okay? So for now, we don't know if your spouse is really immune from getting it again. We also don't know for sure. Whether or not your spouse is still shedding virus or still contagious, like where your spouse is in their infection journey. So we also need to make sure that your spouse isn't contagious too at this point. So your spouse had it now, and so you actually do, until we know more. And your spouse should be able to, as a healthcare worker, should be able to get a COVID test to see if they still have any virus in them. So I would encourage your spouse to go to the hospital wherever they're working and ask to be COVID tested now. there's a saliva test that's being used now in some hospitals, as well as a throat swab, and make sure that they're not still contagious. So that would be the 2 steps. Make sure they're not contagious. If you're antibody positive, make sure you're not still contagious. And we have to make sure that they're not going to get sick again. Yeah. All right. If you test positive for antibodies, how can you be sure you're not contagious? I just answered that. I'm recovering from hepatitis A infection. Does that put me in the category of coronavirus? High risk. Chronic liver disease. People, my immune system less able to fight. If you have a chronic inflammatory disease, a hepatitis A infection, there's no studies that put you in a high risk category, but in general, as a host, like I've been talking about before, your immune system is not as robust potentially as somebody else. And so, yeah, we want to help you do better with that. So we want to help your liver do a little bit better. So I would give yourself put yourself in the category of not an optimal immune system, but you're not a high risk COVID person that they're finding. The high risk people are ending up on the respirators or in the hospital. Okay. Is the Avizia diagnostic test both IgG and IgM? I don't know who that is. I'm sorry, Lauren. Dr. Blum, if you tested positive for the coronavirus and feel better, when can you go around your family again? My uncle tested positive and is feeling like himself again. So at least 21 days from when you first got sick or 7 days since your last symptom. Okay, that's the rule. Right. So he wants to come around my mom. So you're not sure. Yeah. Ideally, it would be good to get another COVID test. But if he's at least a month out already from his very first symptom or when his test was positive, we believe that's good. Ideally, another COVID test would be ideal. Are Quest and LabCorp testing for the nucleic acid as well? No, they're testing for the spike protein. So at least Quest is. LabCorp just announced this morning. I just got the email that they're now testing starting on Monday. So Quest is not doing nucleic acid, but LabCorp, and I don't know which one LabCorp is doing. So we are in the infancy of this, right? We are a little bit in the infancy of this. How long did you say MERS antibody immunity lasts? I believe it's about 2 years. MERS and SARS were somewhere between 2 and 3 years. One was one and one was the other. Lots of talk about a vaccine being mandatory. But what are your thoughts about getting it when they seem to be rushing the process? I don't think it'll be mandatory at first. I think they're going to do it in other populations first. So I think it's going to be mandatory for healthcare workers. I think they're going to end up being the first batch of people, just like flu vaccine is mandatory for healthcare workers. So it won't be mandatory for the whole public until there's more safety data. So let's cross that bridge when we get there. Do I need to worry if I have a clotting disorder and new information is being released, clotting from the virus? That's a good question about that. The cytokine storm people, and so people with, they're finding that there are some now here's the thing. We hear reports of a few people here and there, like they're getting some reports of different issues that are happening in different organs in the body, like a young person had a stroke. This is not the majority of people. It's not even a minority of people. This is like, there've been it's like case studies of these rare things happening. And so in some people, it appears that in cytokine storm, or in some people, they end up with, there is an aspect of COVID that causes the sickest people to get sick because of increased clotting. And so I don't know the answer to that, about if you are a person with a clotting disorder, whether or not you would be at increased risk. That's a good question for your hematologist. Maybe I'll send you to the specialist for that question, but you should ask it, and whether or not they would want you to do anything specific to protect yourself. Like working, like anticoagulation. If you're not already doing it, it could be just a baby aspirin, to do that where you might not have done that previously. But that's a hematologist, because there's different kinds of clotting. There's multiple pathways for how you clot and how different people have increased risk of clotting. And so you need to be assessed in that whole process from someone who's a specialist in that. Dr. Ben Lynch suggestions to decrease manifestations of cytokine storm with nebulized glutathione and melatonin. Yes, I talked about that last week. Melatonin is now looking really good, 3 milligrams and up a day, for reducing cytokine storm. It's not your risk of cytokine storm. It's if you end up in cytokine storm. So I guess if you were getting, if I got COVID and I started, and I'd probably go on melatonin to help calm down the IL-6 cytokine storm pathway. The other really great one for that is turmeric and curcumin. So it's looking like curcumin does that, as well as a nebulized glutathione. I don't know that I saw any studies on that or a specific report about that, but we all think it's good. But melatonin specifically for the IL-6 cytokine pathway, as well as curcumin for that pathway, there've been a lot of discussion about that with some research studies that back it up. And that's also where quercetin came in as a question about quercetin, I believe. All right, I saw CEO of Eli Lilly talking about monoclonal antibody treatment being researched. He said they take these antibodies from plasma, which we have discussed, but they can choose the strongest ones and then juice them up. Cool. I love that. Regeneron is always working on a similar treatment. What do you think about monoclonal antibodies for COVID-19 treatment? I think that would be awesome. I can't imagine that's going to happen for this first wave, as we call it, but I love that idea. And I think that's good outside of the box thinking. And I don't know if they've tried that before with the other SARS or MERS infections, but I like that idea. It's just we're not close to using that right now. That's going to take time. Why is high blood pressure such a high risk? I sort of talked about that before. We think it's because you have people with high blood pressure have a problem in the ACE system. The ACE receptor is not normal for you guys, and that helps the virus gain entry. We think something along those lines. So we think you have a predisposition because you already have a problem in your ACE system. And so if you're on blood pressure meds, not ACE inhibitor, should you plan to stay home longer? I don't know. That's a question for your cardiologist. I think you should reach out and see. You might ask your cardiologist if they should switch you and put you on an ACE inhibitor for your blood pressure, because it's looking like the ACE inhibitor medications are looking like it's protecting people. That's what I read this week. I'm not giving you medical advice, but these are things you're going to go to your hematologist, you're going to go to your cardiologist, or whoever prescribed your blood pressure meds. And with the newest things we know, ask them if you're on the right medication. Okay. My young daughter and I are flying to the West Coast to take care of my elderly mother following surgery sometime this summer. If my COVID antibody testing comes back positive before I fly, should I still quarantine for my parents for 2 weeks before moving into their house? Only you should do a COVID test. You seriously, see, this is where we need to understand. If your antibody testing comes back positive and you know when you were sick, you're going to base it more upon when you were sick than in the timing of things. Then if it was 2 months already since you were sick, we can assume that you were over it and you're not going to give it to her. But ideally, you should do a COVID test. The antibody test is really helpful because it'll tell you whether or not you're likely to get sick again once we know more information about that. But if you were asymptomatic and you never know, you'd have no idea when you got sick and your antibody test is positive, I can't tell you if anything about whether you're still contagious. So it's about whether you're contagious that's going to matter. And if you're not contagious and you are immune, and we know, so stay tuned for more information about that. Keep coming back every week. By the time you go this summer, I'm going to have more information for you on that. Every week, we're going to know more and more. Bye, Sandy. Good to see you. Since what kind of vitamin C do you recommend? Buffered vitamin C is usually best because it won't upset your stomach. I'm using powdered because you can get big dosing up to 3 grams pretty easily. Vitamin C that has bioflavonoids and hesperidin and other kinds of like a broad spectrum vitamin C is great. If you can't get that, any kind of vitamin C will do, but get buffered so it doesn't upset your stomach. Since insurance companies are now saying that a COVID test will be covered 100% by your plan and there is no cost sharing, including copays, do we still pay for the antibody test up front? If you go to Quest or LabCorp, you will not need to pay for the antibody test. And so that's your option to go do that. and you can call your doctor and see if they'll order it for you. And so that's good. If you want to do the KBMO kit with us, that's one of these functional medicine labs, and they're making you pay up front because it's not through insurance. So, so your alternative then, so KBMO does IgM and IgG, and that would be a kit, and that you'll have to pay for. The alternative is to ask your practitioner, or if you're a patient of ours, you can ask us, or if you want to do, we're offering like $100 become our patient, and we'll order the test for you. And I'm sorry we have to do that because we have to spend 15 minutes screening you and making you a patient, and then helping you interpret the results when they get in. So there is a consultation around the testing that takes place, but we're making it easy. So it's just like $100, and we can then order testing for you even through LabCorp Quest. And you'll have to go there and get your blood drawn, and it should be covered. But if you want us to be there, to work with you and help you understand it, then all of our practitioners, it's just our time, and you have to become a patient. But I tried to make that as easy as possible by making this sort of really inexpensive this inexpensive way to become a patient. Okay. I have mild COPD. Should I be taking anything special? Well, COPD puts you at risk. You should go on my website and on my blog. So if you remember, blumhealthmd.com, go to the blog, and you can look for my supplement recommendations. You should be doing, and it's all there. I'm not going to do it now because we're finishing up, but you should be doing vitamin C and zinc and a probiotic at the very least. You might want to take N-acetylcysteine or glutathione or nebulized glutathione if you can get it. We can order nebulized glutathione for you if you're a patient of ours. You can't just get that over the counter. It needs to be ordered through like a compounding pharmacy. Actually, your regular doctor, it's called Mucomist, nebulizer, like a pulmonary doctor. Your pulmonary doctor might be able to order for you nebulized glutathione. It's actually NAC. It's N-acetylcysteine that's nebulized. So you should talk to your pulmonologist about that. But yeah, you should be doing a lot of immune support to protect yourself, to make your host better. So anything you can do for that is good. Check with your hematologist. Good. If we are already suffering from an autoimmune disease, it's likely we are to be adversely affected by another vaccine. I know. Let's just talk about all that later. I'm not a big vaccine fan, but seriously, by the time the vaccine comes out, we're going to know exactly what's going on. For all we know, this virus could completely mutate and become like a cold virus and not be deadly anymore. We know nothing. So let's not worry about the vaccine conversation. That's going to be for a year from now. And we're going to know so much and have so many options at that point, I believe. Okay. I recently took your arthritis challenge and was in all the supplements you recommended. My daughter was sick with what probably was COVID in March. I am an Enbrel and methotrexate, so immunosuppressed. I am wondering if taking all the supplements may have protected you. Unless she didn't have it, but she definitely had all the symptoms and was miserable. So Nina, you're a perfect person. For you, if you should go get your daughter antibody tested, so is early March, you said. It's a month, right? It's been a month. Your daughter should get antibody tested, and if she's positive, then you should get antibody tested. If your daughter's positive, then it was COVID, and that's really helpful. And then if you're positive, then oh my God, how great is that? I really did have it. And it goes to show you there's a lot of people that got it and didn't know it, or their supplement, for whatever reason, as a host, you really fought it really well. And you either didn't get it, and actually there's another whole category of people that we're all scratching our heads and we're wondering if some people's immune systems are so good that they never get it and they never make antibodies because you just resisted the infection from the beginning. And we think there's a whole group of people out there like that to make everything more complicated. And so you might be one of those, and that's actually another issue with the antibody testing. You might be antibody negative, but maybe you resisted and just never got it. So get your daughter antibody tested. And then if she's positive, get yourself antibody tested and then come back and we'll talk about it. But that's why it's a conversation. You need someone like me or a health professional to help you interpret the results, because the antibody testing is not this like black and white thing. I still think it's worth doing, but there's an interpretation piece that you need for that. Would you consider a lab that does an at-home skin prick so we don't have to go out to a lab? Yeah, Karen, actually, I was just saying that KBMO announced today that they're doing a finger stick test. I've been doing, and they've been, that's a lab I trust. So you have to make sure it's a lab you trust. I'm going to start trying their finger stick test with my patients. Yeah. So I would consider doing that. I'm a holistic practitioner. Can I get a list of the alternative labs you use besides the conventional ones? Do you want me to call the office instead? Yeah, Constance, I think the best thing would be to, you can call the office, but the one we're using is KBMO. King, Boy, Mary, or Orange, KBMO. That's the one that we're using. That's the only one to really tell you, to share with you. But you're welcome to, yeah, you can call the office, but you can also go to my blumhealthmd.com website, and there's a support button at the bottom, and you could submit a question. That'll go to Melissa, our health coach, and we can probably help you better there. Thoughts about having home pulse oximeter? That's fine. So Marla just asked about whether to get a pulse ox at home. It's like $60. It just will tell you if your oxygen level's dropping. That's how you know whether you need to go to the hospital. So I think so. I ordered one to come to my house. I haven't gotten it yet. I have it in the office. But if you get COVID and your oxygen levels start dropping, and really, I have to come up with what that number is, but it's probably somewhere around below 94, 95. But anyway, we can talk more about that next time. But and you can Google that. I actually I haven't had to do that yet, so I don't know the magic number below which you want to go to the hospital, but there is a magic number, and you can keep checking your oxygen saturation levels of your lungs. So it's a way for you to gauge whether or not you have compromised lung function. So I think it's a great idea. So order one and have it in case you get COVID. It will help you know if your lungs are okay or starting to get compromised. I think, but I don't want to claim to be an expert. It's important to consider the work of Dr. Judy Mikovits right now, since she had discovered a link between retroviruses and vaccines triggering autoimmune disease. So I do not want to create alarm, but it should be considered any vaccine triggers an immune response 100%. I'm with you. So let's wait and worry about the vaccines next year. And we're not there yet. We need to figure out what to do now. And vaccines won't be here for at least a year. Okay, do you need to take the KBMO to the lab for processing results? No, KBMO is a finger stick. So you actually do it in the privacy of your own home. You put the blood on little tabs. You get FedEx to come and send in the kit to the lab, and then we get the results and we share them with you. I recently had an immunoglobulin group test done. Is this the same test as the antibody testing for the KBMO? Oh, no. So actually, one of the ways we check immune function is to do total amounts of IgG, IgM, IgA in your body. And that's just like an immune, checking your immune function, general. The antibody testing that we're doing for COVID or for any infection that you might have is checking specific IgG to the virus, not just any IgG, right? So some people have immunodeficiency where they don't make good amounts of those antibodies to begin with, and actually that's another discussion for another day. I'm going to wrap us up, but that's a good that sort of is another good reason why somebody would be a false negative, right? Maybe you were exposed, but you don't make good antibodies in general, and so you're not going to see a positive test on the antibody test. So recently, I appreciate your first book. Thank you so much. Bought it for my mom who died of scleroderma. I'm so sorry. Okay, thank you. I'm sorry for your mother's passing. We have to test patients' temperature. What is the best thermometer? Infrared. Okay, I just ordered infrared. But what I'm reading now, and then we're going to hang up where people are adding more questions. This will be my last question. In terms of taking temperature, I am going to take people's temperature when we reopen the office, but it's looking like there are whole groups of patients that are asymptomatic, don't have temperature, right? So I think there's going to, don't have any fever. And so you're going to miss a lot of people by doing temperature, but you'll catch some. So I think that there's a role to play in screening people for temperature, but it's not going to be perfect. So more on that next week. Okay. We're definitely going to have a ongoing discussions about these things, and we're going to learn more and more about them. So some people have a temperature, but not everybody does. And that's why I was saying that the medical students are actually, I read this week that there are some medical schools that have their medical students, especially in the hospitals. There's a lot of teaching hospitals affiliated with medical schools. They're trying to figure out which symptoms help you identify the people who end up in the hospital, or that are most important, to really are matched with people who are COVID positive. And so there might be a whole bucket of people that have a cough and don't have a temperature. And so you're going to screen people, do you have a cough, and do their temperature, right? So we're going to get a list of things. And it might be, for us, we're going to do a little screening questionnaire as well as take the temperature. So I don't think you're going to be able to rely on any one thing. All right, that's going to be enough for now. Everyone, have a great weekend. It's going to be beautiful here in the Northeast tomorrow. I'm getting outside. I'm going to go for a walk in a trail somewhere. Stay far away from everyone else. Stay well and stay home. And for those of you that live in states that are starting to sort of come out, still be careful, okay? I think that you need to be very cautious. Wear your mask, stay away 6 feet from people, and just stay well. And remember that we're here to help. So if you need me, you can submit a question all week. If it didn't get answered, you could submit it through the support button on blumhealthmd.com. That's my online platform website. I have 2 websites. Blum Center for Health, which is where you can go to schedule an appointment to come in and see us. You can schedule an immune consult, which is a very limited visit. You can schedule you can call the office, or you can do everything through Blum Center for Health if you want us to help you with immune testing or to come see us as a new patient. We have all sorts of easy ways to get on board now as a new patient. And then there's Blum Health MD, which is my online platform where I do all the online coaching groups, the online classes, and that's where you can send in questions to our health coach. All right, to Melissa. Have a great weekend. Have a great week. I will see you all next Friday.